Okay, this is going to probably be one of the most important videos I think I've ever made, and I hope it's very helpful. Let's assume this is a patient who is 35 years old and comes in and doesn't like their smile. If you notice, there is a narrowness to the upper arch. There's a little bit of overlap of the teeth. The crowding isn't terrible. The lower crowding is also minimal, but there is a narrowness and a bit of an asymmetry. Do you notice how these teeth are outside of this? These teeth are biting inside. The patient's lower midline is off, and generally they feel their smile looks narrow. Now, this treatment can be done with Invisalign. We widen the upper arch and we adjust the lower arch. And if you look, we have a wider smile. See how the side is moving out? And we improve this crossbite where the top teeth are biting inside the lower teeth. And so this is a nice result on a computer. Now, I would tell this patient that to go from this bite, which is sort of solid and locked in, though backwards, to this kind of a bite like this, is hard to predict that we will get as tight of a contact, as tight of an occlusion that you see here, but that it most likely would still be comfortable for the patient and that they would like the look of their teeth, and that if their bite felt a little less secure at the end of the day, though again, it looks good on the computer screen, even if we couldn't quite get everything looking great like this, the patient would probably be happy. So that's scenario one. Now, scenario two, let's say this is a patient who was sent to an orthodontist by a general dentist who said that you need Invisalign because your bite is going to be a problem for you. And let's say the patient is 45 years old or even 35 years old. And then I speak with the patient and they say they are fine with how their teeth look. Absolutely fine. They know their smile is not perfect, but doesn't bother them in the least. Let's say they are totally comfortable biting like this. They know there's a bit of an asymmetry, but they chew their food fine. They've never had any jaw pain whatsoever. And they want to know, should they fix this? Now, here's the whole point of this video. What you do not want to do as a doctor, as a dentist, as an orthodontist, is leave somebody worse off than when they started. And if this patient is coping fine, they have very little wear on their teeth, there's a little chipping. This can be monitored over time, a little bit of wear. Let's say this is a 45-year-old. They're comfortable. Yes, this is a crossbite, but this chipping is still moderate. Can this be left as it is? And the answer is, in my opinion, absolutely. And you watch, you wear a night guard, perhaps you wear a retainer to protect your teeth. If this is an 18-year-old and you have signs that I just showed you, that may be a little bit different. If this is someone who has jaw pain, that may be a little different. But you don't recommend treatment to somebody who is happy with the aesthetics and the function of their teeth if they, unless they're asking for it. That's the point of this video.